Pregnant women face their own set of challenges during the pandemic. With visitor restrictions, many are concerned that they might give birth alone with no loved ones by their side. Others are simply afraid to come to the hospital. Beth Ward talked to Bay State Medical Center's chair of obstetrics to get answers. Beth?
Well, Jordan, moms-to-be are strongly encouraged, although they are not required to get a COVID-19 test as they enter the hospital. Bay State doctors tell me today that many are nervous and afraid that if they test positive, they will be separated from their newborns.
People are very anxious. They're anxious about coming to the hospital in general.
Dr. Heather Sankey, Bay State's chair of obstetrics and gynecology, knows these are confusing, sometimes scary times for mothers-to-be.
People who are considering home birth for the first time, for instance, and not because they really want a home birth, which is one thing, but because they're afraid of the hospital.
She says Bay State is taking every precaution, and virus testing, while not required, is a critical part of that.
I encourage you to get tested when a test is offered, because that helps us understand what the risk really is. And if all moms are tested, then that allows us to put more precautions in place.
She says right now about 95% of women test negative, and if a test is positive, she says it does not necessarily mean mom is separated from baby after birth.
The best thing for a baby while in the hospital really would be separating the baby completely from a mother who's positive. However, there are downsides to that, as you know, for bonding, for breastfeeding.
So a mother is given two options.
One is to completely isolate the baby to another room. A second would be isolating baby within the room and teaching mom about how to use precautions with the baby. This means wash your hands, wash your breast before breastfeeding, wear a mask while you're nursing, and then you don't spend a lot of time, unfortunately, holding the baby.
Leading up to childbirth, some women are unfortunately skipping routine pregnancy exams.
We are finding that. So what we are offering is telehealth. One of the most important things that we do when they come in, believe it or not, is to check the blood pressure. So we are working to get blood pressure cuffs to women in their homes.
And she says pregnant moms are not giving birth alone. They are allowed a partner or spouse in the room.
What would I like to tell moms out there? Well, the hospital is safe. We're doing everything we can to keep you safe.
Now, Dr. Sankey says that so far studies show that COVID-19 is not transmitted in utero. So far, that's what they're seeing nationally and globally. Also, they said that after birth, it can happen and can create some severe complications, which is why they say protection and knowing is critical to keeping everybody healthy. Reporting live from home, Beth Ward, Western Mass News.